Hey everybody, it's Dr. Mike here at Nature's Vitamins and Herbs. And as promised, we're going to have an interview today with my wife, who is currently on a pretty special diet that has completely, and I said completely, eliminated all of her IBS symptoms. So here's my beautiful wife, Niki, and let's get going. Hey honey. All right, do you want to explain, first of all, what it is that you're doing or what kind of diet it is?
The diet I'm using is basically called Carnivore. It's an extremely low carbohydrate diet that is meat-based, and pretty much all I eat is beef, bacon, butter, and eggs. And I have a little tiny bit of dairy in the form of heavy cream in my coffee a couple times a day. But I don't eat cheese. I did find after I started this diet that it was very difficult for me to tolerate very much liquid milk to drink. And so as a result of that, I eliminated all the cheese I'd been eating, along with several lattes a day. And then I was able to just use a minimal amount of heavy cream in coffee just to make it comforting like I wanted it to be. Most days what I have for breakfast is 3 or 4 eggs, 3 or 4 pieces of bacon. At lunch, sometimes half a pound of ground beef, and sometimes several sticks of venison jerky, deer jerky that came from my son. And other times more eggs. And then at dinner, usually a ribeye. Today I'm going to have some beef short ribs, but most of the time I have a ribeye at night.
So now a lot of people call this a carnivore diet or low carbohydrates, but how did you even come about this to begin with?
I've been dealing with IBS symptoms for about 6 years, and I'd been desperately trying to find some way to treat it. It seemed to me, based on a lot of conversations of people coming into our store and saying how the doctors could not figure out what to do to help them, and they had the same symptoms as me, that diet was the answer. And so 2.5 years ago, I started eliminating things from my diet. And the first thing I eliminated was gluten and grains and as many seed oils as I could possibly get rid of. Any processed food, I got rid of that right away. Eventually I got rid of nuts and seeds, and everything that I eliminated along the way helped, but it never got rid of it. I still had symptoms. And finally this fall, I was looking up treatment for IBS symptoms and came across Dr. Ken Berry on YouTube, who is a family physician in Tennessee who treats people with diet to correct metabolic disorders and autoimmune disorders and all kinds of things. And he recommended Carnivore for the Carnivore diet for people with IBS. And so I thought, well, gosh, I don't have anything to lose at this point. All it meant at that point was getting rid of fruit and vegetables, which was fine. And I did that. And within 10 days, I could tell a big difference. It was a tremendous difference in my symptoms. I mean, it was the most recovery I had had in 6 years. So at this point, I'm going to stick with this at least for 6 months or so to let my gut heal and see if then at that point in time I can start adding in a few low carb vegetables just to see how that works. I may not ever add them back in, but so far I'm pretty happy on the diet the way I'm doing it.
So for those that don't know, what's the difference? I mean, everybody's probably heard of a keto diet at this point in time, if you've been around. What's the difference between a keto and a carnivore diet for those that may not know that?
It's just the amount of carbohydrates that you're eating Keto is I think they recommend less than 50 grams of carbs in a day. And then there's something called Carnivore, which is primarily meat-based, with less than 20 grams of carbs in a day. And then Carnivore, which is, I think, less than 10 grams. I may not have these numbers exactly right, but it's very low carbohydrate. The only carbohydrates I get in my diet are the ones that are actually in eggs, and they don't really count as far as the carbohydrate goes.
So when they say carnivore, I mean, aren't they talking about like, you're just eating things from animals?
Yeah, it's all animal based, and it can be any kind of meat. It can be fish. It can be any meat that you like. The cleaner it gets. So if you end up only eating ruminant meat like beef or deer or elk or bison, one of those kind of meats, if you only eat those and you only eat salt and you only drink water, then that's even called a more strict, that's a lion diet. So you can get even more strict than what I'm doing, but.
Yeah, but you can, you can eat eggs, that comes from a chicken. You can eat, drink milk if you can drink milk.
If you can tolerate dairy, which most adults can't tolerate drinkable dairies.
Bacon, sausage, that's still all from an animal source.
Chicken, salmon.
Yeah. So I think this is interesting, but before you started this whole diet, I know personally that you were taking tons of supplements. So would you like to tell us how many supplements you're taking now?
I take vitamin D, vitamin K2, and alpha lipoic acid because that helps with joint pain and stuff, which I don't hardly ever have anymore, but occasionally I do.
But before that, I'm going to have to say you were taking probably at least 10 different supplements a day trying to deal with the IBS, and you're completely off of all of those.
I was able to immediately stop taking the probiotics, and I was taking a very expensive probiotic trying to keep this thing under control, and it wasn't working. Mm-hmm. But I was terrified to stop taking it because I didn't know what would happen if I did. So, But now I don't take any kind of probiotic and have no problems with any of that anymore.
Okay, so I also know that you talk to other people on the carnivore diet. So what other kind of things are people seeing relief from or getting fixed? And especially even our daughter.
Well, I belong to a couple of support groups of people who are trying this to heal their bodies from chronic diseases, and I'm amazed. I mean, it does cause a weight loss for some people. If you need to lose weight, it will make you lose weight. But it also corrects their type 2 diabetes. It can correct high blood pressure. It can correct so many different kinds of autoimmune disorders that people are dealing with, rheumatoid arthritis and emotional issues. It's amazing how many people have been able to come off their antidepressants because they start eating this way, and it's a healthy way to eat that balances their their hormones to the degree that their emotions are straightened out. Our daughter decided to try carnivore. She really didn't have any health issues to speak of, except that she's very thin, and she's always had massive blood sugar drops where she would become incoherent if she didn't get food in her, and you couldn't even ask her what she wanted to eat. She wouldn't be able to talk to you. And since she's been doing carnivore, which has been 10 days, in that 10 days, all of those symptoms are gone. Her hypoglycemia symptoms are gone. And she said she feels the most emotionally stable that she's felt in forever. So that's good. I mean, she called me yesterday so excited because this was working so well for her.
Well, okay, so who would you recommend? I mean, what would you recommend for somebody that's sitting here listening to this video and they're thinking, oh my God, those people are crazy. If they eat meat, they're going to get cancer. which is one of those, bluntly, a lie that they put out there. But what kind of person, or what would you kind of recommend based on your experience? What would one do?
There are many, many doctors promoting this diet, this way of eating. The three I recommend is Dr. Ken Berry, and another one is Dr. Sean Baker. Dr. Ken Berry is a general practitioner, like I said. Dr. Sean Baker is an orthopedic surgeon, and he has his own practice on that. He's starting to do concierge care, where he coaches people on their metabolic health and tries to get them off their meds and get them as healthy as possible. And then Anthony Chafee he's a neurosurgeon in residency in Australia, but he also works at a functional medicine clinic helping people with metabolic disorders. So all of these doctors have huge followings, and they have massive support groups online where you can join their support group and get all the advice that you could possibly want from other people who are going through the same thing you are, and also from the doctor themselves, where they will answer your questions or look at your lab work and tell you what they think is going on. And they always tell you, I'm not your doctor. Go to your doctor and talk to him about it first. But they have their point of view. And I think it's really interesting that the studies and things that they put up to prove that what they're doing is sound medical advice. Yeah. Not that they're giving medical advice, they're not, but it gives you sound information that you can read yourself and look at and make your own decisions about what you want to do.
Would you just briefly tell this story, because I thought this was amazing, about the woman that weighed 800 pounds. She lost, I think it was 500 pounds on the carnivore diet, and what her doctor told her.
She, in 2 years, had lost 500 pounds in a healthy way. I mean, she was doing better and better and finally feeling better. And she said that she finally had discovered the off switch, the ability to stop eating everything in sight and learn to control her appetite. And she went to the doctor, he checked all her labs, everything was great. Her hemoglobin A1C was looking better, her fasting blood sugars were looking better, everything was improving. And he said to her, but I'm really concerned about your diet, because he knew the way she was eating. And it doesn't make any sense why you would not see the truth of what was in front of you. This woman's health had improved so dramatically in that 2-year time. And for the first time ever, when she was 800 pounds, he never ever talked to her about her diet, is what she said. But now he wants to talk to her about her diet. So it's interesting.
Okay, well, I guess we'll wrap this interview up, and maybe we'll get my daughter on next week and see what her experience is. So thank you, everybody, for watching, and that's us. And remember, peace.